Hi, this is Dr. Rajkumar, Director Research at MedGenome, Bangalore. So this month is the Prostate Cancer Awareness Month. Before we get into prostate cancer, what is prostate? Prostate is a very small gland. It's about walnut sized, present just below the urinary bladder and in front of the rectum. And this plays a very important role as far as male reproduction goes. The prostate as such has the urinary tract from the bladder. There is a path called as urethra which passes through the bladder, passes through the prostate, as well as from the seminal vesicles you have another duct which passes through the prostate, which helps in the nourishment of the sperms. The sperms are going to come from the testis and the storage part, which is the epididymis, and that duct fuses with the seminal vesicles duct and they join and pass through the prostate. In the prostate and in the seminal vesicle, the fluid which is there will be important both from the pH point of view. They are alkaline, so they protect the sperms from the acidic environment in the vagina, as well as also provide fructose for the sperms to have energy. So this is in simple why we need the prostate. Now, coming to the diseases of the prostate, one of the important or more common disease even before cancer is what is called as benign prostatic hypertrophy. It's called as BPH. This is present as people age. The prostate tends to enlarge in size, and it can potentially cause problems in passing urine, and therefore it needs to be attended to. So if people have hesitancy in passing urine, not able to empty the bladder, it is better that they have a checkup which needs to be done, and also at that time, if needed, the surgeon, the urologist will be able to remove the excess amount of tissue. You don't need anything major there. Now, coming to the prostate cancer per se, prostate cancer is one of the common cancers in the elderly. I'm here mentioning it as elderly, meaning people who are above 75. Now, in India, in 2022, we had almost close to 38,000 new prostate cancer cases. Now, essentially, the incidence of prostate increases from around about 45-50 and then peaks around 70 years of age. The important thing is the earlier the onset of prostate cancer, the more aggressive it can be, and some of them may be related to familial, that is hereditary cancers. Now, prostate cancer per se can have similar symptoms like benign prostatic hypertrophy, meaning it will have problems in passing urine, the stream will be very thin, some people may even have passage of blood in the urine. And in as far as diagnosis goes, a clinical examination by a urologist where they do a digital examination or put a finger into the rectum and then they palpate the prostate, as well as a blood test called as Prostate Specific Antigen can be done. Now, this will help in making a diagnosis of when the PSA, Prostate Specific Antigen levels are elevated. There's a high degree of suspicion that it can be malignant, and especially if it is above 10 to 11 nanogram per ml. So in that situation, it needs to be investigated more. The first thing we need to do then is, if it is a biopsy is required, once a biopsy is done, you need to confirm that there is going to be any spread beyond the prostate. If there is no spread, we call that as localized prostate cancer. It can be easily treated with surgery or radiation. If it is spread to the lymph nodes, again surgery or radiation should be okay. But if it has spread beyond that, then it needs what we call a systemic therapy, hormonal therapy, and plus minus chemotherapy depending upon the aggressive nature of the disease. Potentially, important thing we need to remember is the cancer detected in a very elderly individuals are very slow growing. So you don't need to aggressively manage them. You can keep them on follow-up. So that is an important take-home message. So now I'm going to be talking about the genetic factors and personalized medicine or medical care for prostate cancer. Now, when you talk about genetic factors, now we need to remember that we normally have 2 copies for every gene. We receive 1 copy from a mother, 1 from a father. So there are a few genes which are known to be associated with prostate cancer, and that abnormal gene which has been passed on from either mother or father can cause prostate cancer. Among the genes are BRCA2, BRCA1. We also have entities called as MLH1, MLH1, MLH4, PMS1, PMS2, etc. And you also have some rarer genes also. Now, the importance is that some of these genes like BRCA1, BRCA2 are not only associated with breast and ovarian cancer in the women, but they can also be associated with prostate cancer in the men. So if there is a family with breast cancer and with a mutation, a cancer causing mutation in BRCA1 or BRCA2, if there is a sibling who is a male, they run the risk of developing a prostate cancer. And this is particularly important for BRCA2 mutation, which is much higher risk compared to BRCA1. So the risk goes from around 25 to almost 50% risk. What it means is that there are 100 men with BRCA2 mutation, 25 to 50 of them may develop the disease, prostate cancer, during their lifetime. So conversely, 50 to 75 of them may not develop the disease. So there are modulation factors which can modulate that risk. Another set of genes which are associated with prostate cancer, which can play a role, is what we call as DNA repair associated genes, mismatch repair associated genes. So it is in this we will have MSH2, MLH1, etc. Now this is important because the more number of mutations, these DNA repair genes are responsible for repairing our DNA when the DNA replicates. And if they are not there, it keeps making errors. And when there are large number of errors, it means that the tumor, the cancer, can stimulate the immune system. And that is where we keep that as another entity, because you have a different form of therapy now which is available for them. Now coming to what do we do if you have a family history of prostate cancer? If there is a family history, then you will need to screen the other siblings, male siblings, for prostate cancer, and this has to start even from the age of 40-45. So they'll need to undergo doing the PSA examination and digital rectal examination by the urologist, and this has to be done on a regular interval, every year or every 2 years, depending on what the urologist feels. And if you do find something abnormal, you need to do the full gamut of biopsy, etc., and then the treatment has to be given if malignancy is detected. Now, in those who have a BRCA1 and BRCA2, now these are also DNA repair genes, but they are in a different path, they are in a different mechanism. They are called as homologous recombination repair genes. And when they are abnormal, you have the option of using another type of drug called as PARP inhibitors. These can be used for those who have these mutations in BRCA1 or BRCA2 or these homologous recombination repair genes. Coming to the other entity which I mentioned, which is DNA repair genes, mismatch repair genes, where you have a more number of mutations happening, they offer the opportunity to treat these patients with immunotherapy. So you need to assess for what we call as tumor mutation burden. So that is done by next generation sequencing. And if high tumor mutation burden is there, then they can be given the treatment with immunotherapy. As you see, the prostate cancer is something which can be eminently treatable and potentially curable, and it also can be kept under control for a long period of time, even in very advanced cases. So one doesn't need to worry about prostate cancer. More important is to diagnose prostate cancer, especially in the early stage itself. Thank you.